How does air conduction relate to mixed hearing loss? Imagine trying to listen to your favorite song, but parts of it sound muffled or distant. That's similar to what happens in mixed hearing loss, which involves both the outer and inner parts of your ear. Air conduction is the main way sound travels through your ear. It begins when sound waves enter the outer ear, travel through the middle ear, and finally reach the inner ear where the nerve sends signals to your brain. When we test hearing, we measure how softly you can hear sounds traveling this natural pathway. In mixed hearing loss, both the conductive and sensorineural parts of hearing are affected. Conductive hearing loss happens when there's a problem in the outer or middle ear, like fluid buildup, damage to the tiny bones, or a perforated eardrum. These issues block or weaken sound waves before they reach the inner ear. Sensorineural hearing loss occurs when the inner ear or auditory nerve is damaged, which makes it harder for the brain to interpret sounds even if they reach the inner ear properly. When testing someone with mixed hearing loss, their air conduction thresholds are usually worse than normal. This means they need louder sounds to hear through the natural air pathway. Bone conduction testing is also done, which bypasses the outer and middle ear by sending vibrations directly to the inner ear. In mixed hearing loss, bone conduction thresholds are also elevated but not as much as air conduction thresholds. The difference between these two measurements is called the air-bone gap. This gap shows how much of the hearing loss is due to the conductive problem. So, air conduction is directly related to mixed hearing loss because it shows the combined effect of both the outer or middle ear issues and inner ear damage. If the air conduction thresholds are much worse than bone conduction thresholds, and there's a noticeable air-bone gap, it indicates a mixed type of hearing loss. This helps audiologists understand what's causing the hearing difficulty and plan the best treatment. For example, if the conductive part is due to fluid or infection, medical treatment might help. If the inner ear damage is significant, hearing aids or other assistive devices could be recommended. In summary, air conduction testing is vital for diagnosing mixed hearing loss because it reveals how much the outer and middle ear problems are affecting hearing, alongside inner ear issues. The difference between air and bone conduction thresholds, the air-bone gap, is a key sign that both types of hearing loss are present. This information guides healthcare professionals in choosing the right approach to improve hearing and quality of life. Always consult with a healthcare provider for a thorough assessment and personalized treatment options.